Hello, my name is Alastair MacGilchrist and I'm a liver doctor here in Edinburgh. That means that I'm looking after patients who are admitted to hospital with liver failure. Sadly, they often come to light when the disease is already irreversible and they often die. For many, indeed most of these patients, the reason for their liver disease is alcohol. And of course, if it's related to how much they're drinking, these deaths are preventable if only we could influence how much people drink before they develop this irreversible illness. There are, in fact, as I discovered when I started looking into public health measures, very effective ways in which we can influence how much we drink. One of the reasons why the deaths have become so high here in Scotland is that because alcohol has in fact become much cheaper in real terms. And we know that policies which influence price are the most effective way to influence alcohol harm. That's why I, as a clinician, was delighted when in 2018 Scotland was the first country in the world to introduce a policy called minimum unit pricing, thereby setting a floor price below which alcohol could not be sold. The great beauty of MUP is that it specifically targets those very cheap, high-strength alcohols such as white cider and cheap vodka, which are favoured by the heavy drinkers who are doing themselves so much harm. So minimum unit price, MUP, has been in place for 5 years now, and it's time to review whether it's worked or not. I'm pleased to say that the evidence is very strong that it has indeed been effective. We know for sure that it has reduced alcohol sales, and when we look at alcohol harm, we notice that deaths from alcohol fell by 10% in the first year after it was introduced. So clinicians like myself are delighted that we have minimum unit pricing here in Scotland to help reduce alcohol harms. It's good not just for me as a doctor, but more importantly for the patients and their families. Every alcohol death is preventable and MUP saves lives.